short arm cast is applied when immobilization or support of the wrist is required, for example, distal fracture of radius or ulna. Following instruction will show you how to apply short arm cast on the proper positioning of the limb, and a common position is with the wrist of slight dorsal flexion. For patients' extra comfort, it is highly recommended to apply kneel underpad as skin protection. Kneel underpad allows the patient to take a shower or enjoy swimming while wearing a cast. Kneel underpad is made of Aero Silver, which is 99.9% antibiotic and water repellent, so it doesn't make unpleasant odor and itching. Please make sure to instruct the patient to dry up the cast and kneel underpad with a hairdryer once the cast gets wet. Select the appropriate size of kneel underpad and measure the length from the palmar crease to the elbow. Make sure that you use enough kneel underpad to allow foldbacks at the distal and proximal ends. Prepare a smaller size of kneel underpad to protect the thumb area and make a 2 cm cut to easily slide it over the thumb. Make a small diagonal cut in the kneel underpad for thumb. Gently roll it on and remove all wrinkles. Since kneel underpad acts as a buffer to protect the fractured limb, no additional padding such as cotton bandage and stockinette is not recommended for ideal performance of kneel underpad. Put on protective gloves before applying the casting tape. Open the casting tape and apply it without the water in order to have enough application time. You may shorten the set time by dipping the casting tape in the water. It is another benefit of kneel cast to be easily unrolled without water. Wrap the casting tape at the wrist and work distally to the hand. Make a 2/3 cut at the thumb and curl the edges of the casting tape to make a smoother edge. And keep applying the rest of the casting tape proximally to the elbow. Fold back the kneel underpad at the proximal and distal ends, and then create a cuffed ends for more comfortable fit. Now take a second roll and dip it in the water for 10 seconds and squeeze out the excessive water. Start wrapping at the wrist and work distally to the hand and on the thumb area as previously instructed, and continue working toward the elbow, overlapping 50%. Make sure to leave approximately 1 centimeter of kneel underpad exposed to leave a soft edges. Take care that the edge of casting tape is not touched on patient's skin. Mold the cast with the palm of your hands, checking for any pressure points that may cause irritation. Separating the muscles of radius and ulna when molding prevents the wrists from getting out the proper position. Hold the patient's hand in an arm wrestling position and finish the molding. When application is finished, the bigger muscles should be immobilized and the smaller muscles has enough mobility to make a fist. It helps faster healing after removing the cast. And now you are done with short arm cast.